Evidence-based practice is it's a combination of both what we know works, or what research has shown can work for certain populations in certain places, with the local context and needs, and the clinician or the program provider's best judgment on what's appropriate in the context. It's important because we do know a lot about what works, and we should not be guessing or winging it or just doing what we've always done. We should be leveraging our own experience and the needs of the community and their own experience, plus all this great evidence that's out there. So that's really incumbent upon whoever the practitioner is and the agency or system they work in to really support that. Determining the level of evidence can be challenging. On one end of the continuum, there are programs that have a lot of evidence, some home-based visiting programs, for example. Systematic reviews are more and more popular. Some sources for those are the Cochrane Review and the Campbell Collaborative, among others. If you don't have a systematic review, or there's not enough evidence for a really high-quality systematic review, and that's often the case in a lot of our public health programs right now, then again, the next somewhat harder step is to go to the literature and look yourself. Determining the level of evidence is, particularly for a typical practitioner who's not perhaps steeped in the evaluation methods or the research methods, or it's been a while since you don't do that in your daily work, it's challenging. That said, I think there are probably 3 or 4 ways, guidelines that you could follow. The first is relevance. And when I say relevance, researchers by design typically choose a fairly narrow topic and research it to death and really focus in on it and really test, does X affect Y, right? That's often where our research drives us. And that's great. So it may be broadly relevant to your topic, but it may not actually be research that helps you make a decision about what you're trying to do, or it may only be a piece of the larger question you have for a complex need, say for pregnant women who are trying to stop smoking, right? One piece of evidence is not going to build you a program, although it may contribute. So relevance is really critical. And then I think it's really important to ask the obvious question, what's the level of effect, right? If we're relatively in the zone of what I'm interested in, what level of impact or effect has been shown? And do we even have enough research for us to ask that question or answer that question? The next, again, and even more challenging though, after you've determined this is relevant and there is some evidence of effect, or whatever evidence of effect or experience can be gleaned, what is the quality of the research? So this really goes hand in hand with the previous one. I like to just say, is there some evidence that this works? And now let's look at how confident I can be in that level of effect that's been shown. And I guess here I really want to acknowledge that, again, in maternal and child health and public health more broadly, we're often trying to identify discrete pieces of evidence and then weave them together into a program. And so we have even an extra layer of complexity to deal with. For simplicity's sake, though, you could at least get those discrete pieces identified to later build into a program. So, unfortunately, determining that a program is evidence-based is just the first step. So the next steps then really begin with preparing to deliver the program or programs that you've selected. You often, though, won't find much, or enough at least, about how to deliver those programs, which is where the implementation piece comes in. What does it take to do this developmental screening program well, right? So if we want to move from screening to referral to actually high quality service, there's a number of actors and a number of things we would need to do there. What does it take to address even one of those, much less the full continuum? This is where we often struggle to get beyond what we're trying to achieve to how we will achieve it. And again, in our complex systems, there's a lot of people involved in a lot of different systems. Your human resources, your data collection and analysis infrastructure, your direct service providers, your managers, your policymakers. So the complexity kind of goes in multiple directions. It's definitely a multi-dimensional challenge. I'm optimistic because our methods are getting more complex and more sophisticated. Done well, implementation gives more voice to consumers and providers and the various staff that work in the program. So everyone has some higher level of accountability that if done well, if implementation is attended to well, more people feel accountable and a part of the change and a part of the work.